Good morning. Call to order the Human Services Committee Standing Committee meeting of Monday, March 11, 2013. We are looking for an approval of the agenda.
Move to approve the agenda.
All right. Next up is public comment. Is there anyone out there that would make a comment? Public comment? All right, we will move on to the committee items. The first item to be discussed, approved, is are the minutes of the February 11th Human Services meeting.
Move approval.
Support.
We have approval and support. All in favor? Great. All right, our first department to report to us is the Health Department. Mr. Hall?
Hi, good morning.
Good morning.
You received my monthly update. The only thing I really wanted to update you on was talk a little bit more about the sequester. We are still waiting to hear from the Department of Community Health if they're passing along any cuts to us. The MELF meeting is currently going on, and the MDCH report was just about to happen before I came over here, so hopefully we'll have some information soon. I can say that NACCHO sent out a press release in regards to this, and they had indicated that since 2008, local health departments have eliminated 40,000 jobs due to budget cuts. And the U.S. Department of Health and Human Services estimates that the CDC's budget will be cut by approximately $350 million over the next 6 months. And 2/3 of the CDC's budget goes to state and local health departments, so that would account for $230 million. So they indicated that potential outcomes of that would be 540,000 fewer doses of vaccine against diseases like hepatitis, flu, measles, and whooping cough, 25,000 fewer breast and cervical cancer screenings for low-income, high-risk women, 400,000 fewer HIV tests, and up to 2,100 fewer food inspections. So those are, again, that's national statistics though, so we're still waiting to hear what potentially will come down from the Department of Community Health. So that's basically it for the monthly update, unless you have questions.
All right, any commissioners? Questions? Yes, Commissioner Rice.
Hi, Steve.
Hi.
A comment, actually, or even a question regarding your Power of Me, the program that you have here regarding the 11 to 13-year-old girls, as far as putting together the program for responsibility as far as teen pregnancies goes. Is there a program out there? Has there been any thoughts to having a program for boys and their responsibilities in this?
I know part of this one specifically geared towards girls. They do have programs that focus on boys as well, and that's part of the TOP program, and they have mentors, and I can get you more information on that. Michelle White kind of leads those issues, but yes, there are programs for boys, and they participate as well. In fact, about 2 staff meetings ago, as a general staff meeting at the health department, we had a presentation on some of those programs.
Thank you.
Yep.
Any other comments or questions from commissioners? All right, we'll move on to 4C, Health Department, the initiation of the fees for the walk-in STD clinic services.
Okay, and Mary can come up here if she'd like, but basically the bottom line is at our STD clinic, since 2003, we have not been able to charge for any walk-in services, and it's really gotten to the point that we've actually even heard from clients that other health departments have told them to come to Jackson County because we didn't charge a fee. And we've even had people from out of state, and I believe that's all in the memo. But the bottom line is that we have to provide that service, and the thought here is that we could recoup some of our expenses and also discourage out-of-county people from coming to our clinics. No one would be turned away for not having the money. That's one of the state requirements. So we don't expect to have everyone pay, and when we discussed it with other counties that charge fees, they don't get a lot of money as a result of this. It's, like I said, the bottom line is we want to try to recoup some expenses and try to discourage people from non-Jackson County residents from using the STD clinic. Anything you want to add?
If I may ask this question, you may not turn anyone away. Is that only from Jackson County, or is that any county in the state of Michigan?
That's any.
Any county in the state of Michigan.
Anyone that comes through the doors, we have to provide service.
Thank you. Any other commissioners? Commissioner Plaschek?
So how did
Good question.
Yeah, that is a good question.
Some counties actually do not have an STD clinic. The public health code says that we must assure that a client is offered STD services and assure that they get the treatment required. So those counties, and I don't know how many there are, but if they do not actually have an STD clinic, they're sending them to surrounding counties. Our surrounding neighbors, one of them that does send clients to Jackson, they to my knowledge, they don't have an STD clinic, but I guess they're assuring that a client gets treated by sending them north.
Can we make sure that those counties know that to tell the people that there will be a charge if they come to Jackson County?
What we are going to do is, if this does pass the full board, we will start, we'll put an article in the paper, and we're going to start advertising, giving our clients specifically enough notice that this is going to be happening, and then what we'll probably do is send out a blast fax to the local health departments.
Take it a step further for what Commissioner Plaschek just said. So if you put call it a blast out there, let everybody know what's going on, specifically non-residents and the $20 that you're referring to, will the stipulation be in there also that if they can't pay, they'll still get service?
Yes.
So the deterrent may not be quite a deterrent then?
Well, the hope is that, even though the $20 charge will be there, it's all about the wording. And I've talked to my staff about how they can ask the client for, if they can't afford the $20, well, what could you leave us today? And we show the clients what their charge would be for their particular visit. And sometimes those charges are over $50. So, and then hopefully with time, clients will realize that we're not a free clinic.
Any other commissioner comments? All right, unless there's any additional information to be shared, I'm looking for a motion to move to the full board the revision of the Jackson County Health Department fee schedule to add a $10 fee for Jackson County residents and a $20 fee for non-residents for walk-in services at the STD clinic.
So moved.
All right, we have a motion and support. All in favor? Aye. All opposed, the same? All right, this will go to the full board. Thank you.
Thank you.
Thank you.
We are next up to committee items for D, Department on Aging.
Good morning. In your information is a copy of a PowerPoint that I would like to walk through, and what I want to talk with you about is Department on Aging budgets and how they fit in with the County Commission strategic plan. And I'm using slides that were recently used in current strategic plan meetings talking about strategic plan. And the mission is to deliver quality programs that address public needs, and for the Department on Aging, we're targeting older adults and their caregivers, their family members. And our mission that the Jackson County Advisory Council on Aging has is helping seniors live full, active, and independent lives. So as you'll see, that encompasses both senior site activities and in-home services. And here's your strategic plan depiction, and then Department on Aging services primarily fit in the healthy community section. And of the healthy community goals, I just wanted to point out 3 of them that fit with Department on Aging services. The services we provide do help with emotional health, physical activity, and good nutrition. We also have a program called Geriatric Mental Health that works with education with regard to depression awareness, memory screens, also counseling to help cope with both a senior experiencing grief and loss and also a caregiver that has the stress of caring for someone around the clock. And then the third, one of the healthy community goals is to secure federal and state funding, and we do have federal and state grants through the Older Americans Act, the Office of Services to the Aging. And just a reminder, we don't, because of the Older Americans Act, we don't charge a fee for service. We do have suggested fair share donation amounts for all of our programs. And with our services, we're the ones on the far right for the cost of care for in a day. When I calculated it a couple years ago, is $6.23. And we don't provide daily care, but what we do offer in the home, a meal, a bath, light house cleaning, respite for the caregiver, that's so the caregiver can leave for a few hours. That helps families have their loved ones stay at home longer. And as physical needs, though, increase, the need for care increases. And that's good that there's services that can provide that. And that's where it goes, but the cost goes up as the amount of care moves to the left. All right, so our 2 major components are senior sites and then home services. So what I'm going to talk about are programs based on org keys or budgets, what our budgets are called, and then what programs are underneath those budgets. And we have 6 different budgets. The first is called in-home services, and that includes when someone requests lighthouse cleaning service or respite, bathing assistance. We do an initial assessment where a outreach worker goes and talks with the senior in their home. Family members may be there, what their situation is, what resources in the community are available that could help them out, and then start Department on Aging services if that's appropriate. And with lighthouse cleaning in this budget, that's done every other week. It's 2.5 hours every other week. For some people who don't have any family support, sometimes our home care workers will do errands, buy groceries, go to the pharmacy. Laundry, bathing assistance, in-home respite that I mentioned, that's care, being with someone who needs around-the-clock care so the caregiver can leave for 3 to 4 hours. And then unmet needs is when there's a one-time need, such as a furnace repair, and we check all of community resources to see what might be available to help that person, but unmet needs might help pay for that final $100 so that the furnace can be repaired. That's what we call unmet needs. In-home services mentions that in-home assessment that I mentioned, and it also, we have caregiver education and assistance that's part of this budget, and that is Jennifer Guthrie. I've mentioned her name before, and she talks with people who are caring for someone around the clock. It's more in-depth, it's beyond the giving the information about resources. It's talking them through how they can better handle their situation, especially if the person they're caring for has memory issues. And So that can also evolve into counseling for the family, just depending on what their situation is. And also creating confident caregivers is for people caring for someone who does have memory issues. It's a class, 2 hours a class for 6 weeks, and that's part of this budget as well. In-home services, just for an example, in 1 month time, 500 will be in the home of 530 seniors for about 3,200 hours of service, a wide variety of services. This does not include Meals on Wheels. And one of our outcomes in our budget performance measurements, 90% of people receiving home care service report that they're able to live independently in their community, in their home, as a result of the services, the in-home services that we provide. The next budget is called Senior Center. There's 2 senior centers, Crouch Senior Center and Spring Arbor Senior Center. And there's a variety of programs in the senior centers. There's lunch every day. There's different exercise classes. We had about 240 participate in exercise classes last year. Music, lots of activities, classes, woodworking, different events. And at least 75% of seniors surveyed will report a higher degree of health and life satisfaction. This is a new outcome that we've implemented for the current year that we're in. So we're saying 75%, but we think it'll be higher than that. The next budget is called Senior Citizen Programs, and that includes quite a variety of programs. Case coordination and support, that's the in-home assessments I mentioned for people who are getting Meals on Wheels. That's initially in every 6 months. Caregiver information and assistance is more of a one-time kind of conversation, either over the phone or in the office with someone who's caring for someone else, whereas in the previous budget I mentioned it's more intensive. So this one is done more over the phone. Case coordination I mentioned already. And it is required for our Meals on Wheels and home services to do that in-home assessment. And of the people who received in-home visits for case coordination or an assessment, 99% report that they're better able to understand services as a result of having that contact with our staff. And under that budget of senior citizen programs, that also includes staff time with Triad, and that's one of the secure community goals too, is education in the public, and so that fits with that strategic plan. Project Fresh, that's where seniors in the summer get $20 worth of coupons to purchase fresh produce, and then My Cafe is helping people apply for food stamps. Also under senior citizens budget, there's chore, installing grab bars, handrails, Medicare Medicaid assistance program. This is quite a large program. And last year, the staff and volunteers helped 700 seniors with their Medicare supplemental insurance choices and Medicare Part D re-enrollment every year. And based on what the senior was previously paying for their coverage and what MAP helped them to gave them options of things to choose, they total up, have a running total of how much money that saved. And last year, seniors saved $1.7 million. And the MAP volunteers like me to point out that that's money that they spend in the community then. And then administration's under this budget, and that includes grant management, and we have the annual senior festival. The next budget is called Home Delivered Meals, which we refer to as Meals on Wheels. Meals delivered to homebound, and it's a hot meal with the option of a cold meal for supper, and then frozen meals can be delivered for the weekend. Again, just depends on the person's situation. So in a month's time, we'll deliver about 19,700 meals to 580 different people. And of the people we surveyed, they all said that a meal to their home assists them with better nutrition. Then the other budget is congregate meals, which are senior nutrition sites. And there are 6 nutrition sites and then the 2 senior centers, so there's 8 sites. And in a year, 1,900 people will have participated in one of our nutrition sites, and there's lots of volunteer opportunities at our nutrition sites. There's health and wellness education every month at our senior sites. We have volunteer income tax assistance volunteers, again, the MAP volunteer program. And the 97% of the people surveyed reported that the nutrition and socialization at a nutrition site helps them, remain healthy and living independently in the community. And then the final budget is called Geriatric Mental Health. This is respite for people who are caring for someone with memory issues or Alzheimer's. 90% of the caregivers say they're better able to cope with their caregiving by having the respite in their home. And they do, with this respite program, it can either be in their home or they could take their loved one to another, like a daycare facility or overnight care at a nursing home. There's options there. And it also includes depression education, memory screens, counseling. A lot of people are experiencing grief and loss. It was interesting, I looked up the suicide statistics for Jackson County, and the over 60 suicide rate was just over what the rate is for age 25 and under. They're pretty close. And it's just, it's the small, just to give you an example, Amy Jensen, one of our counselors, talked to one of our senior sites. She calls it mental health bingo, and it talks about depression and what the signs are. Someone there heard her talk, told his girlfriend about it, and her dad was experiencing some dreams and problems with when he was in the war, and it hadn't hit him for decades, and now that he's not feeling as well, he was struggling with dealing with these things that he had experienced in the war. So won't say which one, but so she's been able to talk with him and talk with the family and help them better cope with what he's experiencing. And 91% of people receiving counseling report being better able to cope with their circumstances. And we're community collaboration. We work with other organizations through the Area Agency on Aging. We get over $900,000 worth of grants, and we work with these other entities. So I have one more topic, but before I go on to sequestrian funds, any questions about our budget names and what programs we cover?
Commissioners, any questions on her report? Seeing none, I guess you may continue.
This came in after the reports were due on board docs, and Steve Hall mentioned it earlier too, and I just wanted to show you a list of our federal funds and state funding. I'm hearing two different percentages of what may be cut. Sorry, the total for 5% didn't get entered there. It's about $31,300. So, and I could email this to people, but I just wanted to give you a snapshot of the value of the funds we receive. And I talked to the Area Agency on Aging. Ginny Woods Broderick is the director there, and we're both kind of a wait and see. We're not sure if the cuts will be 5% or 1 or none. So she's keeping an eye on it as well, and she told me that the Area Agency on Aging may have funds that could replace the federal funds somewhat. Just depends on what may happen. So I'm just doing a wait and see. But what we'll base on, and if I come to you with any suggestions, what I'm basing it on is your prioritization. And this was your last one, where you looked at the budget names for all county budgets. Ours are shown in highlight. So what this tells me is our in-home services and Meals on Wheels are a priority. And because we want to help people stay in home, living at home as long as possible. And then I will talk about this at a future meeting, but I did a prioritization of services survey with the Advisory Council and our staff. And they both agreed that Meals on Wheels is a top priority. And they all agreed on the bottom 6 as well. Maybe not the same order, but it was but I'll talk about that at a future meeting. So any questions?
Commissioners, any additional comments or questions for Marcy on that additional information? All right, seeing none, thank you, Marcy. Up next on our agenda, 4E, Michigan State University Extension. Mr. Shane?
Good morning. I'd like to give you a brief update on some of our
our programs and introduce a new staff member to you this morning. And since sequestration seems to be a theme, I'll give you an update on what we're thinking for Extension 2. So just to start with, I would like to say that you should have received in the packets a brochure for the Citizen Planner program that's going to be starting in Jackson County in April. Essentially, Citizen Planner is an opportunity for individuals involved in local government and volunteers and roles like that to learn more about planning and zoning and all of the rules and regulations and policies and things that go along with that. It's usually a 7 to 9 week program series where you get a lot of different topics in those areas. We have a really good team that puts that program together each year. And so the registrations are out now for that. And like I said, the program starts in April. So if you know others that might be interested in that, townships that you work with and those things, if you'd like to share that information and registration information, we'd certainly appreciate that. Phil Toko is kind of the point person here in the Jackson office to handle any questions or registrations, but the actual local policy team will be the one that's conducting that program. So if you have questions about that, you can contact Phil or me, and we'll try to help you with those and be glad to get anyone connected to it that we can. The other big program happening in Jackson right now is the Master Gardener program. This is something that Bob Burkalt's working on. As you may recall, Bob Burkalt's a consumer horticulture educator that the county partially funds. He works in both Washtenaw and Jackson County. He's working with the consumer horticulture team to bring the Master Gardener program here to Jackson this spring. They have a really good turnout for the class, and things are going really well with that. So one of the benefits of having the Master Gardener classes is that you also get a group of volunteers at the end of that come and volunteer in the community for different horticultural related projects. So we're really glad to be able to bring that to Jackson County again. It's on kind of a 3-county rotation right now between Livingston, Jackson, and Washtenaw. We'll be holding a class in Washtenaw this fall and then be back to Livingston probably in the spring again and continue on that rotation if current staffing stays as it is now. The next piece, in the past we've had urban collaborator interns that work in Jackson County, and Phil and the team kind of put that group together. There's usually 1 or 2 of them depending on the funding that we have available through the grant, and I think this year they're going to be able to fund 2. They did some interviews last week for those, and so the nice thing again about those is that those are individuals that work in the community on things like community gardening and those sorts of projects, planning and those kinds of things, and so we're really happy to be able to bring that to Jackson County again this year, and Phil's going to be kind of the supervisor for those positions, but the whole team in the office work with them to help connect them to different projects. They work for everything from agriculture to nutrition education, so we're really glad to be able to do that again. In terms of the 4-H programming, we're really excited that there was a lot of questions when we went to our new programmatic structure with program coordinators. Instead of just having the extension educators housed in the office, we went to program coordinators. What was that going to do to our program statewide? And what our new dean, Fred Poston, who's the old dean, become new dean again, what he announced, I haven't seen the report yet, but what he announced at a meeting I was at with him last week was that our 4-H numbers statewide actually increased quite significantly. And in Jackson County, I don't have the exact number, but there was an increase in participation in 4-H as well. So the model seems to be working. We're increasing our impact of those programs by having the program coordinators and having educators out doing education around youth development topics and getting other people connected that way. One of the big ones that this district is really becoming known for is leadership and civic engagement. There's a team that goes around to different counties and teaches kids parliamentary procedure, how to run meetings. It's kind of a unique way that they do it. They do it through creating trail mix, basically. So you have all of the ingredients that you could ever think that you might want to put in trail mix, and they actually run a meeting to decide what ingredients you put in and how much and all those kinds of things. And so kids bring up topics like, well, we want to add peanuts, and someone else will say, but I have a peanut allergy, so we shouldn't add peanuts. And so they go through the whole process of running a meeting and making decisions, and at the end they have trail mix to consume. So it's kind of a fun way to learn that, but they make amendments and motions and do voting and the whole thing. So it's a really neat opportunity for those kids to be engaged in that type of activity and helping to create future leaders through the 4-H program.
The other big announcement in 4-H is that many of you probably know Renee Applegate. She's announced her retirement. She's going to be retiring from Extension at the end of June. Her role has been working partially with the Leadership and Civic Engagement Work Group, and then also partially running the International 4-H Exchange Program on campus. And so we're not clear yet exactly how we're going to manage those positions. If a position would be replaced here, we have other educators in the district doing Leadership Civic Engagement, so I don't know that we'll have another educator housed here in the Jackson office or just what that might look like. And they're also working through a plan of how they're going to manage the International Exchange Program. But they'll be working on that in the coming months as well. So she just announced that in the last week or so. So we'll miss Renee, but we're glad that she's able to do that. So in terms of our agriculture programs, there's a lot of things going on. Last summer we had the drought, and that impacted a lot of things in terms of feed prices, and some of the other small to mid-sized farms are struggling more with that than some of the others and trying to manage through that. So we're seeing an impact in terms of environmental issues and the costs of handling those things versus buying feed for livestock, and so our ag team is really working hard on that. We had a drought team last summer. Now some of the livestock areas are really working on trying to work through those issues with the producers. And the other one, obviously, because of feed cost, is looking at how to most efficiently manage those animals, exit strategies for those that just can't do that, because hay and grain prices are higher than they've been in quite a long time. So it's difficult for some of those small to mid-sized farms to maintain if they don't have the acreage to produce all the feed that they need, or if they couldn't produce what they needed. That's a specific challenge. So our team is working on trying to help producers through that transition and doing some business planning and those sorts of things as needed. The other thing in the ag area that I wanted to alert you to, you may hear it in the community as we get closer to events happening and things, is that last year we did a Breakfast on the Farm event here in Jackson County, and we've kind of rotated them through this district. This year there's a farm, Scott and Allie Ferry in Litchfield, Michigan, have volunteered to host the event this year, but they're kind of in that mid-sized dairy farm range, and they do quite a bit of irrigation, and based on their experience last summer, they're concerned that that's going to take quite a bit of time. So the producers typically choose the dates, and they selected a date in September. Unfortunately, it's the same date as the Family Farm Fest here in Jackson County. So the team is working on trying to work with the ferries to see if we can adjust that date a little bit. If not, we're going to be very conscious of not pulling extension staff away from the local Jackson County event. We'll find other volunteers and educators to make sure that the Breakfast on the Farm event happens, but we don't want to do anything negative to the event that's been ongoing here in Jackson for a number of years. So we're going to try to maintain that the best that we can. And then in terms of recruiting for the event, we won't do nearly as much publicity in the Jackson County area for Breakfast on the Farm since we just had one here last year. We'll let those families focus on coming to the Family Farm Fest, and we'll do more focus east-west from Hillsdale on trying to draw people in for Breakfast on the Farm. So we'll see what happens with that. They may decide on a change of date. The other challenge is it happens to also be the opening weekend of the Hillsdale County Fair, which isn't an ideal time either. So we'll see where that ends up. Nancy Thalen's working very closely on that with the family to try and find a solution that best fits the needs of everybody, but it's hard to find farm families to open up their doors to bring in an event of this nature, and so we may end up making a change or we might not, but we'll do our best to make sure we don't conflict with other events that are happening in the community. So just a quick update on our budget situation, and then I will introduce our new staff member. The sequestration funds, obviously we don't know what the bottom line impact is that's going to be yet, and we won't know probably for some time, but based on the current estimates, we're going to be in the neighborhood of somewhere around a $600,000 cut to our federal funds based on the most current number that we're using. We're hoping to stay in that 5% range, but we'll see where that amounts to. What we're doing right now is just holding any state and federally funded positions vacant that aren't critical fills for us right now, so that we can try to wait and see what's going to happen and hope that we can manage those cuts through just having vacant positions for a period of time. The other big change for us, though, is related to some of the funding from the Farm Bill, because in funding for Farm Bill includes the funding for our Supplemental Nutrition Assistance Program, which is our nutrition education. And so what we found out early on in this process, even before all the sequestration stuff came up to be, is that they shifted some funds out of the Farm Bill to some other programs to try to maintain those programs, and that funding included $110 million nationally for the SNAP-Ed program. And so what that means for us in Michigan is a 28% reduction in our funds for our nutrition education program. So we're trying to do the same thing right now, is hold positions vacant. We have 2 program associate positions that are vacant in Jackson County right now. We have 1 in Lenawee. We have 1 in Washtenaw, just in this district, that we're holding until we find out more. We may have some other funds through another nutrition program that we might be able to backfill some of those, but that's really where we're sitting right now with that. So we'll see what the final impact of that is as we move forward. We're negotiating with the state because the state is the one that helps to determine what numbers we need to reach to be eligible to continue with those grant funds. So we're having to adjust that based on the reduction in funding. So that's all things that are ongoing. Fortunately for us, as we already had a SNAP-Ed educator position in the works before the budget cuts, so we were able to go forward and fill that. And so I'd like to introduce to you this morning Carol Foster. She comes to us from Ingham County. She will be a Jackson County resident in the near future. She does have a place that she's going to be moving to here. Her main office location is going to be the Lenawee County office, but she also is going to provide supervision oversight for our SNAP-Ed staff in Jackson, Lenawee, and Hillsdale County, and then doing some other work around disease prevention and management. So with your permission, I'd have Carol just come and briefly introduce herself and then entertain any questions you may have.
Good morning, and thank you, Matt. As Matt alluded to here, I will just be moving into Jackson County here within the next week. So I'll bring with me my grandchildren, and I've lived here before about 20 years ago. So I've been with MSU Extension as a program associate, and I'd like to be able to bring some of the experience with programming into the educator position so that we can continue as MSU Extension to be well-rounded and build strong families. That's our goals throughout the counties here, Jackson, Hillsdale, and Lenawee. So I will be available to your office, to the community, for any needs that you have within our realm of programming that we can do, which is vast. I'm very pleased to be here, and it's so nice to have been invited to the meeting here first thing this morning. And of course, I will be HN1, Health and Nutrition Educator, as Matt stated. And if there are any other questions or any concerns that you have for me, I can be reached through an email with cfoster@msu.anr.edu. So that's one way to reach me. Also at the county office here, MSU Extension on Lansing Avenue, and my cell phone. So I'd like to be available to you for anything that's needed through MSU Extension, and I am very happy again to be here. Thank you for welcoming me.
Thank you, and welcome back to Jackson.
Thank you so much.
Thank you. Are there any questions from commissioners for Matt and or for Carol? Yes, Commissioner Plaschek?
Matt, I took the Citizen Planner class the last time it was here in Jackson, which was, what, 3-4 years ago?
Probably 4.
Is there enough changes in the class to take it again?
I will check on that and get to know. I'm not as familiar with the details of what they're teaching now. I think so. It's always a moving target. They try to bring them back to communities every 3 or 4 years if possible, because there often are a number of changes that are relevant. So I will confirm that for you, and I'll get in touch with you and let you know, but I believe that there would be.
Okay, thank you.
One final question, simply for clarification. Could you share with us what SNAP-Ed is?
Yeah.
And or the acronym, or?
Yeah, Supplemental Nutrition Assistance Program.
Thank you.
So that's it's formerly we used to call it FNP, Family Nutrition Program. More commonly, the slang word for it would be the food stamp program. Food stamp nutrition education program is what it used to be. I mean, that's kind of what it used to be. Now it's bridge cards and everything else, but it's the same. It's nutrition education for those on food assistance.
It's an evolving term.
Yes,
I see.
always.
Thank you.
Always changing acronyms. So.
Any other comments or questions from commissioners? Well, thank you for that report.
All right,
Appreciate
thank you.
it. And again, welcome, Carol.
Thank you.
Up next, we have agenda number 4F, the medical care facility. We are to receive the quarterly report and monthly financials. Ms. Place?
Good morning, everyone. Under the pillar of finance, all of our financial and bank statements and resident trust funds were reviewed, as always, per month. Monitored census to staffing to make sure that we maintain control over our staffing expenses. And I also met with therapy providers on the continuing evolution of our marketing plan to increase our Medicare census. Our AR days out are holding at 42, which is a vast improvement from a high of 81 over about approximately a year ago. So we're very proud of that number. We were only slightly over budget in January despite not being able to admit for a portion of the month due to DPNA, and we also had a flu outbreak that prevented us from admitting new residents at that time. All of that has been resolved, and we are happy to say that we are happily admitting, and our census is quite high right now. If you have any questions about our financials, I can bring Mary Ann up, and she'd be happy to answer any of those that you may have.
Commissioners, any questions for our director or finance people? I don't see any.
Okay.
All right.
Under people, we are beginning to negotiate with MNA, our RN union. This is the only union that will be immediately affected by the right to work law, so that those negotiations initiating will be the first in this new challenge that we face. We had 3 step 2 grievances over the last 3 months, all of which were upheld when we met. I facilitated all the routine operational meetings. We conducted an in-house Eden training for 24 staff in late December. And I've been reviewing policies and procedures as a customary practice early in the year. So I've been up to my ears in policies. We honored staff for years of service with JCMCF and Penta celebrations, and we also, and I didn't have it in this report at the time it had to be submitted, but we had the highest number of perfect attendance for last year that JCMCF has ever had. So we had 22 people that we honored for perfect attendance for the entire year, which is really extraordinary. Under quality, we provided insight and oversight and guidance during a recent complaint visit, and that was a facility-reported incident. That has turned out very well, but we don't have the report yet, so I can't give you the final details. All incidents and accident reports are reviewed, and they are up to date. I participate in rounds quite often. Continue to chair the Medical Care Facilities Council Quality Team, and that is a new effort for the Medical Care Facilities Council and very welcomed. Facilitated quality improvement meetings and established the Corporate Compliance and Ethics Committee programs, which are now mandated by the Centers for Medicare and Medicaid Services. We have met twice with each of those, and we're off to a very, very good start. Met with our psychological services provider to beef up the services that we provide, because approximately 38% of our clientele receives some sort of behavioral health services. Under service, we contributed to each, or I contributed to each of the newsletters and communiques, and we have approximately 4 of those. Attended the United Way reception that was held a couple months ago at Darrell's, where JCMCF received an honorable mention because we met our goal in approximately 2 days. It was a little less than 2 days. Provided families, residents, and staff short training on medical marijuana in the long-term care setting. We had some residents that had questions and wanted to use medical marijuana as a medication, and that education provided them the knowledge and insight so that they knew that we were unable to do that for them. That's not something that we can do because we take federal dollars. Presided over the Medical Care Facility Region, or Council Region 3 meeting, and attended the Jackson County Behavioral Care Network. Under growth, attended the Michigan Alliance of Person-Centered Communities Steering Committee and Strategic Planning Session in January. Met recently with the county IT people to discuss the growth of that department and the services that we'll be providing. We initiated Tai Chi classes for our residents, which has gone over very, very well. They really like that. And our wellness team has just recently met to do our strategic planning for this year's offerings for our staff, to provide a wonderful place to work. At this time, with your permission, I would like to bring up Mr. Williams, who would like to present a resolution, agenda change. You're welcome.
I have received an email from...
Just 1 second, please. First of all, are there any questions for Sandy in regard to her report? Let's wrap that item up. I believe first would be most efficient. Commissioners, are there any comments or questions for Sandy regarding either of her reports? No.
Thank you, Commissioners.
Okay.
I received an email from Michael this morning regarding a resolution which I was planning on submitting through you. I can just give this to Mike, and then you guys can handle it next month. Is that all right? Or do you want me?
I believe board policy states that there's a procedure we'll go through, and I think since there are no timely issues and it has not been presented to the public by meeting that deadline for the board docs deadline, we'll just go through that procedure.
Not a problem. Thank you.
Any other comments from any other commissioners or administrator's office? All right, thank you. It appears we are moving on now to Agenda 4G, the Lifeways. Ms. Mary Beth.
Good morning. Giving you an update this month for Lifeways as to what's some activities and things that are going on, primarily related to the local funding. We continue to work with the county. Currently, we've received a proposal in regards to economies of scale with our facilities and maintenance, and we are reviewing that internally at this point. The other thing that we've done working with the counties is related to IT and communications, and she has been a tremendous help with our review of our current phone system and the need to upgrade, and providing some technical support to both our IT and facilities, and we're moving along in that direction. The other thing that we're continuing to look at is related to the building itself, and we, as leases come up, we are continuing to renew leases to have them at fair market value for those tenants to create additional local revenue. Right now, we do have with our CBRE contract, which is the leasing consultant, a potential proposal regarding a tenant for that vacant space, the old Hollywood space. So right now we're in the process of negotiation and are hopeful that we will have a tenant for, which would be about 8,000 square feet, which would be good. The other thing that I wanted to mention related to some of the things that people have talked about today too was the sequestrian. I always pronounce that incorrectly, but we do not yet know the implication for Lifeways at this point in time. Through the association, they're evaluating that, and we'll be announcing soon what the implication will be financially if we do have an impact. One of the things we do know is that it does have an impact on the mental health block grant for substance abuse, but we are not aware of what that implication is related to Lifeways funding at this point in time. The other thing that I wanted to mention, as you know, we've been heavily involved in the regionalization of the PIHPs in the state of Michigan, where they're downsizing from 18 to 10. Currently, we are in the process of submitting what's called an application for participation, which is due April 1st. We're all 12 CMHs, which are in this 21 county region, which they're calling us Region 5 at this point in time, are submitting that proposal as one region. So it's a lot of work about the regional entity has to be a separate entity from any current PIHP. So it's the development of an organization currently that does not exist. So as you can understand, that there's a lot of work and time being spent in the formation of this new regional entity. I will have more information, obviously, by the April meeting, because we would have submitted that at that point in time. It will be a representative governance structure for this regional entity, where they will have representation from each of the CMHPs, two-member appointments. So, but again, as I know more, I will bring that here. The other thing that Lifeways did in the month of February is, as a board, we adopted a resolution in support of Mental Health Excellence Act. I don't know how many of you are aware of that act that was introduced by Senator Stabenow in regards to obviously the need for continued support for funding for mental health services. Unfortunately, in light of the incidents with the Newton incident, that it has brought significant awareness to the fact that many individuals in our communities are in need of services, and that when we've seen a reduction in general funding, those were many of the individuals who would have qualified and met criteria for us to be able to pay for those services. This act supports Medicaid expansion, and our board is in support of the state's of Governor Snyder's proposal for the Medicaid expansion as well. That would allow us to be able to serve many individuals who are in our community right now who do not qualify for Medicaid, who are falling in the cracks. And so just wanted to let you know that as a board, that was something that we are in support of. That's it for my report. Any questions?
Commissioners, any comments or questions? Commissioner Rice?
Yes.
Mary Beth, can you explain a little bit about the collaboration of the work that you it's recently been discussed regarding the Center for Family Health?
Oh, yeah. Forgot to mention that. We have, that starts actually March 25th. We are jointly working with the Center for Family Health, where they're going to be having on-site physical care 2.5 days a week. One of the key things, reasons why we've done that, is we saw a need at Lifeways of individuals who do not have primary care services. About 1,500 individuals who have Medicaid do not have a primary care attached. And we do know that individuals who are on medications for mental illness have side effects related to obesity, diabetes, heart conditions. And then if we are able to better coordinate care and get them connected with primary care, that we can improve their quality of life, reduce the cost of services, both on the physical health side and on the behavioral health side. So they will be starting. We did receive a mental health block grant for this to start, and we're really excited about it. It's been something that's been in the planning phases for quite some time. We started over 1.5 years ago, where we provide behavioral health services on site at the Center for Family Health, and saw excellent outcomes as a result of that, and wanted to do the same when we brought physical health care on site for behavioral health needs.
Thank you.
Any other commissioners' comments, questions? I think mental health is definitely the topic for the day. As you weren't here for our 8 a.m. session, I quickly wrote down, we had information presented to us on concerns for our veterans,
Yes.
for our seniors, for our youth, and the prosecuting attorney also addressed it, and that's just in a matter of a few hours. So it is obviously an area we need to be cognizant of, and thank you for your report.
Yeah. Could I mention on behalf of what you spoke related to the veterans, that was also in the resolution, a discussion about the fact that, I don't know if many people are aware, but Jackson County is a county that does receive a significant number of returning veterans, and the need for behavioral health services for veterans is significant. So yes.
Thank you, and thank you for your report. All right, now our final department report is from the Department of Human Services, our quarterly report. Jerome?
Yes, good morning, and thank you. I apologize for not getting out our statistical data. I neglected or omitted to sending those last week when I sent in my report. I hope everybody's gotten a copy of those.
I believe in order, I would need a motion to receive that document, commissioners?
Motion to receive.
All in favor?
All right. As you can see, if you look through the statistical report, there haven't been significant changes in many of the areas. We have had a slight increase in the state disability assistance. We've been working with what we call our MRT, or medical review team, actually, which is located in Lansing. We do local eligibility determination and send on that to a medical review team. There have been some backlogs in those, and we've been working closely with the MRT team to clear up those backloads, so you'll start to see those caseloads start to climb a little bit now. So that's the only significant change with that. Another change you will see is the increase in state emergency relief, where it says SER applications on your statistical report. Significant increase in the number of people needing state emergency relief for things like rent and other household needs that they cannot pay. We have handled those. We've actually had quite an increase on our staff, a burden on our staff to actually process those, but I think we've been fairly timely with those and getting that out into the community so people can stay within their homes. As I go through the rest of the report, you'll see there aren't any real significant changes. We still have quite a bit of reception traffic through our lobby, despite the fact that we have instituted an online application process, and we actually process half of our applications are online, so you would see the significant number of people that would be coming into the office otherwise if they weren't doing online applications. So we are still quite busy these days. And in my report, I talked a little bit about our transitioning in accounting systems. It wasn't as smooth a transition as we would have liked to have had, but I think we've worked out a lot of those issues. We've had a couple of our staff locally actually working on a team to help resolve those problems. We are starting to get payments out with local funds, and those are starting to happen, and we're getting caught up with those. We're hoping that we'll take care of the rest of our local fund issues here in the near future. One of the things that we concentrated on was making sure that payments got made to foster parents and to other service providers that are providing service to the families that we work with. One of the other changes that we are experiencing is that I previously had spoken about the 48-month time limits for receiving cash assistance, and we are now dealing with the 60-month limits on those, as well as federal limits of 60 months. And that happened as of March 1st. We had quite a few cases closed as a result of that. We did give significant warning to families that their case could be closing, and they had a right to a hearing before that case closure. So that's gone fairly smoothly. We haven't had a lot of difficulty with that. The cases that were closing, families were aware that they were going to close, and there was a significant number of those families that were already partially employed, so softened the blow with that. We did offer housing assistance with some of those families that their cases were closing, and we have had very few people actually come up and ask for assistance with that. We have continued to try to meet our modified settlement agreement caseload ratios, and this time was the first time that we've done that since they instituted the modified settlement agreement, that our staff caseload ratios were actually within the limits that they should be within. And that means that we've hired enough staff to handle the cases that we have. We just finished another round of hiring and added 3 more children's services workers. So we are, at this point in time, and I'll knock on wood, fully staffed in children's services and hope to stay that way. We have 3 more positions to fill in our administrative support, and if we're able to do that, we hope to do that within the next 2 weeks. If we do that, we are actually fully staffed for the first time in 2 years at the office. So we're hoping that'll help with the caseloads that we've been dealing with. And actually, it has helped in the payments area, because the last report I got was that our workers are now averaging 510 cases apiece within the payments area, and that is down from, at one point in time, we were up in the high 700s, and some were in 800 cases per worker. So it's actually a workable caseload at this point in time. We are moving forward with electronic document management, our paperless system in the payments area, and that should happen this summer. There'll be a trial run with a couple of counties actually in April, and then if that goes well, we should be going up in July. That was supposed to happen for us last fall, but due to problems with that program, they decided to wait until they worked out all the difficulties. Our children's services staff actually have started with the mobilization of process. They are actually working outside of the office, and we have, excuse me, quite a few of our workers have volunteered to be a part of that, and it's actually going quite well. Some of the feedback I've gotten from workers are that they're actually more caught up on their case reports than they have been since they've actually been working there. What it's done is allowed them to do some work from home, some work in the community, which they were already doing before within their investigations, and also a partial time within the office. So we're hoping that that'll continue to go well. The future hope would be that we'd be able to mobilize more of our staff, and we'd have less of a need for the office space that we have. So that's actually gone fairly well. We've had a few difficulties in what it means to be able to be mobile, and are you allowed to work from home on a regular basis, and explaining it to staff that cannot be their work site, that they actually have to be out in the community and in the office and not just at home working on reports. So that's worked out fairly well at this point in time. Staff have been very cooperative with that. We are working with the Center for Family Health to streamline our referral process of children to the dental program, and we hope to do the same thing with the medical program with our children that are in care and the other families that we work with Children's Protective Services, and making sure that dental and medical care are getting to all the families that need that. We are working to improve our community approach to juvenile justice programs, and we're continuing to speak about that within our community forums that we've been involved with. We're actually trying to secure training programs and a community contract for those training programs here in the near future. We had a review for our foster care licensing, and happy to report that we maintained our regular license. We saw some areas that we need to continue to improve, but I think we're moving in a really good direction with our foster care program and our Children's Protective Services programs. The one thing that I didn't mention in my report is that we are preparing for the Medicaid expansion. We have a work group together because it'll be a great increase in our volume of applications for Medicaid, and we're working in a work group with our central office to try to make sure that we're prepared for that when that happens. That's all I have. If you have some questions for me, I'd be glad to answer them.
Commissioners, any comments or questions for Jerome? Commissioner Plaschek?
Good morning.
Good morning.
If you said this, I missed it, but with the SER applications,
yes.
How many of those are you able to fulfill? I mean, the request was 1221. Are you able to fulfill all of those? I mean,
no, can't fulfill all of those. There are eligibility requirements. Those people that actually fill out an application for utilities, we do not fulfill those. We refer those to agencies that have received funding for that, such as Salvation Army, the Community Action Agency, and those other agencies in the community that provide for utilities. There are those that we can fulfill, such as rental and housing, as long as they haven't hit their limits on those. There are some medical needs that people have. We have some other funding available to us outside of state emergency relief too. We refer to other community agencies and community funding.
So of the 1221, do you know how many you fulfilled?
I could get you that. I don't have that right at my fingertips at this point in time. I can give you a percentage of that.
Yeah. Okay. Thank you.
Yes.
Commissioner Rice? Comment or question?
A comment on the Adult Protective Services. You had January 2012, you had 32. January of this year, you've got 62. Could you comment on that, please?
Yes. We actually have had an increase in that over the past year. I can't speak to exactly what it is. I can talk to you. We've had a great increase in the number of adults that have been taken advantage of financially. And we see that in hard times, that families take in other family members, and we find out, to meet their own bills, and that has happened. We've seen an increase in that. We've also seen an increase in the number of those referrals that come to us because we've gone to a centralized intake program. It appears as though people feel more comfortable in making those referrals, and we've gotten the word out that there's a central intake for taking referrals, and we've received an increase in number of those. So we've been pretty busy in that area.
All right, thank you.
Thank you.
Any other comments or questions from commissioners? Thank you, Jerome, for that report.
Thank you.
All right, now we move on to number 5, which is other business, claims, the February claims.
I move to pay the claims.
Oh, Commissioner Leitner, how thoughtful of you. A motion to pay the claims, support?
Support.
That was a very hesitant but a formal support. Thank you, Commissioner Rice. Up next, we have minutes from other meetings. In our packet, you will find the January 2013 Advisory Council Aging minutes, as well as the Human Services minutes in your packet.
Move to approve both meetings, minutes.
Support.
All right, thank you. Thank you, Administrator Overton. We did have the motion. I'm backing up to 5A. We had the motion and the support. Thank you for that offer. Let's actually vote on that. Otherwise, I might get stuck with it. All in favor of paying the February claims? Say aye. Anyone opposed? Thank you. Thank you. And we have the minutes. The motion was made and supported to accept those minutes. All in favor? Aye. Thank you. And up next, we have reporting schedule for April. In April, we will hear from Animal Shelter, Community Action Agency, Lifeways, Health Department, Department on Aging, Region 2. Now we move on to number 6, which is public comment. Are there any individuals, including IT staff, that would like to make a comment? Yeah. Don't want to leave you out here.
Call me out.
Any public comment? All right, thank you. Committee member comments? Any other commissioner comments? Seeing none, I believe I will adjourn to the call of the chair for trail mix treats to refine our Robert's Rule skills.